Developing news now as we focus on reaction to the president's big, beautiful bill. President Trump's budget bill slashes a lot of federal dollars, including all funding for HIV prevention under the Centers for Disease Control and Prevention.
Well, some warn the move could roll back decades of progress in fighting the virus. Today, 10 TV's Colin Dorsey is sharing the story of a Columbus man who benefited from that research.
We've made a lot of progress, but I think all of that can be quickly reversed and all those gains can be lost very rapidly.
Dr. Carlos Movastudo specializes in infectious diseases at the OSU Wexner Medical Center.
I've been working on HIV and AIDS actually for a long time, even before I went to medical school.
His work on HIV spans decades. He's concerned without the money being spent on prevention efforts and cuts to Medicaid, we could see another resurgence in cases.
These are very successful programs, and those efforts have taken us to where we are now, where we've made a lot of progress. But I think all of that can be quickly reversed and all those gains can be lost very rapidly.
The city of Columbus has long made efforts to stop the spread of HIV.
Columbus health officials are talking on the AIDS issue. Gary, what's happening there?
The city is considered a hotspot city with new infections more than the national average.
Is it possible to survive AIDS?
It's opened the city up to more federal funding, which currently isn't affected.
Tell me your story.
Well, I was diagnosed with HIV in 1985. I was one of the first people to test when the test came out.
For 40 years, David Vargo has lived with HIV, even through some of the worst years of the epidemic.
We were watching our friends die one by one, and then it became 5 by 5, and then 10 by 10. People were dying all around us. I lost about 35 really good friends in the first 10 years of the AIDS crisis.
He credits his life to science, the medications that keep the virus below detectable levels and that keep him alive. They're medications that are expensive, covered by his insurance.
My drugs, if I was to have to pay for them, cost $3,000 a month. Just the HIV medication is $3,000 a month.
But for those who could lose Medicaid coverage, the drugs would simply be unaffordable without help from last resort safety net programs like the Ryan White program. Vargo fears cuts to prevention programs, testing, and access to medications like his could result in even more new cases.
We're going to find ourselves in a very dangerous situation.
And that was Colin Dorsey reporting. It is important to note that new HIV infections have been steadily declining for years. In his first term as president, President Trump vowed to end the HIV epidemic in the U.S. by the end of this decade. Now, according to the federal government, more than 700,000 Americans have died from HIV and AIDS since 1981. Well, that does it for your news at 4. We do have much more news straight ahead on 10 TV News at 5. Colin?